Hey everyone, it's Nurse Ags back again with another video. Whoop whoop. Alright, so this one is for all my new grad nurses or for my nurses that are entering new nurse specialties. I have been a nurse for about almost a year now. I cannot believe that, but there are certain things that looking back I wish I did differently, slash things that I did do that I think really helped me out. And that is what I'm going to share with you all. So if you are a new graduate nurse or if you are a nurse entering a new nursing specialty, then stay tuned. All right, so tip number one is to make a cheat sheet. And what I mean by this is there's going to be a lot of different things you're going to have to remember to do, and it's going to be hard to retain it. Not unless you have photographic memory or just a better memory than I do, then having a cheat sheet, or in my case, a little cheat notebook, will be very helpful. So mine was really inexpensive. I got it from the Dollar Tree, and it's one of those little small notebooks that look like this. And they're small enough that I was able to fit it in my front scrub pocket, so I could easily pull it out and reference it whenever I needed to. And things I would keep in here, for one, if I just needed, to jot down something real quick that the doctor told me or a patient's vital signs, I could write it on here. Otherwise, I would, during my training, I would jot down little things my preceptor would tell me that needs to get done. That is something that I kept in my little notebook and that I would reference in times of need. Tip number two is that whenever a provider goes into your patient's room, be sure to go in with them. The reason being, you learn a whole lot, not only about the patient, but also the patient's care. And what happens is the provider is responsible for explaining to the patient, what we're doing and why we're doing it. And the patient will often ask really good questions. And as a new nurse, yes, you just graduated from nursing school, so you have a really good knowledge base, but sometimes, especially when you're in a specialty area, you don't get the opportunity in nursing school to really learn the specifics, all the specifics of why you do certain things in that specialty area. So what I found was whenever I did follow the provider into the room, which for the most part you should do that anyways, just so that y'all are all on the same page on what we're doing with the patient's care. But I really took it as an opportunity to just really learn more about what's going on with the patient physiologically, as well as what I need to be doing for that patient's care. So make sure you follow the provider into the patient's room. Tip number three is to not be afraid to ask for help. Okay, that is probably one of the most important tips in my opinion, because you cannot do it all. At the end of the day, you want to practice safe care. So if you are not 100% sure about something, use your resources. Yeah, a nurse might think you might be asking a silly question, which they should not. Do not feel like you're super nurse. If you feel like you're being stretched thin, advocate for yourself, advocate for your patient, ask for help. All right, tip number four, I'm on four now. Tip number four is to cluster your care. This is something that I really struggled with at the beginning. I'm not gonna lie, I'd be in and out my patient's room. I would forget things. So instead, what I started doing was at the beginning of my shift, I would just take a moment to kind of just jot down my plan for that morning. What I was gonna do first, what patient I was gonna see first based on priority. We learned that in nursing school, how to prioritize. So I'll take the moment to kind of just figure out who needs to be seen first, what needs to be taken to them, and what needs to be done. That way, you are just being more efficient with your time. The patient will appreciate a lot more because you won't be in and out of the room. And just overall, it's just better care. Just to cluster your care and just be thoughtful in how you approach your patient. All right, this brings me to tip number five, which is be thorough in your assessment, your patient assessment. It is so important for that patient's care, because what happens is, based on your assessment, that is how the doctor or the midwife, if you're in labor and delivery, how they will kind of determine their next move for the patient's care, what they will order. So if you call the doctor saying, oh, the patient is complaining of X, Y, Z, they're going to ask you some questions return, such as what are patient's vital signs, how did the patient, like the fundus feel, what was it before. So you don't want to be looking like Dumbo the Fool, like stumbling over your words, like, oh, hold on, let me go ask, I'll be right back. Like, no, you don't have time for that. Make sure you do a thorough assessment. Try to anticipate what the provider will ask you, what they need to know to give you orders. So you don't have to, tell them, actually, I don't know, I'll call you back. Like, try to have that all figured out first, and then you'll want to call a provider or, call whoever you need to, continue with the patient's care. So make sure you do a thorough assessment. My very last tip, which is so, so important, is to celebrate the small achievements and to be easy on yourself. There will be so many times where you feel so incompetent, you don't know what you're doing, you don't know how you even passed the boards, okay, how you got the job. But you are meant to be there for a reason. Okay, you got hired for a reason. You are knowledgeable. So just remember that you had the training to do the job the right way, to be safe, and to be compassionate in your nursing care. So just remember that you are meant to be there for a reason, and that your patients need you. Okay, like this job, it's so service based, and just understand that you are needed and that you are wanted where you are, and to celebrate the small achievements, whether it is getting an IV started on the first try. For me, I'll never forget when I was able to feel the cervix for the first time. That thing is hard to find, okay? And there was times when I didn't know what I was feeling in there. But when I finally felt the cervix and I actually got the exam correctly, I felt so proud of myself. So just taking moments at the end of your shift just to just reflect on, what you did well. Also, patients are gonna, say thank you. Like, take that in. They're gonna say they couldn't have done it without you. Like, just enjoy that and understand that you will get better as time goes by. It's a journey, but to be easy on yourself, excuse me, and to celebrate those small achievements, those small but great achievements. And I wish you the best of luck if you are starting a new job as a nurse, or if you're starting a new specialty area. You will do great. I have 100% faith in you. So go out there and kill them. And I will see you all on my next video. Bye.